Good morning, everyone. I am Paul Horvath. I am the representative from the OSL Health Ministry Committee. Thanks to everybody for joining. This is now our third virtual education event for 2020. Last month, sorry, I was about to say last week. Last month, Dr. Sarah Chambers had a nice presentation on dental health. You can find that on the church's YouTube page, or if you go ahead and search for that, it is still posted. A handful of people have been out and viewed that in the last month, so that's great to see. We will plan to record today's presentation, and after a little bit of time for editing and some technical details, we'll also get that posted. That takes about a week, so give us at least a few days to get the footage edited and posted. I think with that, I am going to turn it over to Jan Pesa to introduce our speakers, and I will ask everybody to just go ahead and mute your mic, and then we'll take questions after the presentation. Jan, go ahead. I'll pass it over to you.
Yes. Hi, good morning. Today's presentation is entitled Dealing with Dementia During COVID and the Holidays. And just a little background here about dementia. Dementia, of course, affects many of us with our families, our friends, in our work, in our church community. By understanding what to expect, ways to communicate effectively, and support services that are available, we can better support those affected by their caregivers and their caregivers. Margy Hagman and Margi Stauss, both retired social workers, have had personal and professional experience working with families dealing with dementia and help to provide services for them. We will be going to a video, and then after the video, there will be time for questions. And we're delighted to have both Margis here, and you'll get to see them now as we go over to the video.
The video right now?
Mm-hmm.
You're not going to say anything?
It's not.
Okay.
We're all dealing with COVID-19. These times are strange. We're feeling the stress, the anxiety, and being isolated from each other. We know how it affects us, but think how it affects a person who's confused. Their routine is shattered. They're used to coming to church on Sunday, and maybe as a group going out for breakfast afterwards. Well, now they aren't, and they don't understand why. Each week they may be saying, why aren't we going to church? And you may say, we don't have it, it's on Zoom. But still, it's hard. Other things they may have enjoyed doing, like going to the senior center. It's closed. Maybe going to the gym, and you don't feel comfortable going there anymore. Maybe the card group is no longer meeting, or going to a movie is non-existent. Or what about the Friday night fish fry? You used to go there and you used to talk to the waitress each week, and now you aren't going out, it's takeout. And the person who has dementia doesn't understand this. Why can't I see Jan and George? We always did before. Summer gave us a little bit of relief where we could be outside. We could sit on our patios, we could social distance with people and enjoy the company of others or take walks. But now as it's getting cold and dark, we aren't going to want to be outside as much. I encourage you to take the opportunity, though, when we have a sunny day, to get out and take a walk in the driveway, round the block. Enjoy the sunshine. We need that vitamin D. But also as it gets colder, to think about your loved one and how they have to adjust. You know, they no longer can wear the short sleeves and the shorts. You need warm, comfortable clothes to put on, and so keep that in mind. With this season too, one of the things we see is what we call sundowning. It's getting darker earlier and it's dusky out there, and they look outside and who's that guy out there? What are they doing out there? They're looking at us. Look at them. They're right over there. And what you need to do is shut the curtains, pull the shades down, turn the lights off, and have a warm atmosphere. The other thing then we see during this time is just increased confusion. Things that used to be so simple to do maybe aren't anymore. And we forget how many steps are involved in things. Like saying, go brush your teeth. And they're going, well, where do I go? You may have to put labels on the doors so they know what room to go into. And then they get in there and they're looking around and, well, what do I use? They may pick up the right thing, but then, do I use this? Or do I use this? And then it's putting the toothpaste on, and what do? It may be time that you go in and say, okay, let's go in the bathroom and let's go brush our teeth. And you may have to model for them, showing them how to take the item and how to use it properly. All those little things that can be so difficult.
One of the things that happens is that when we have masks, people can't even recognize us sometimes. And when they have to wear a mask, and particularly if they wear glasses and their glasses get all steamed up, they don't understand why they have to do this, and they can't even recognize their best friends. A lot of how people relate by recognizing people, and that's one of they will recognize a person. They may not remember their name, but they will be able to recognize people and recognize faces. And so that facial expression is very important to them, and they're not able to do that now. I'm going to take mine off though so I can talk. One of the things that happens is some of the other kinds of activities that we can do during this time period is there are activities that are because this is a holiday, and this is a time when things are different than they are other times of the year. For one thing, Margie mentioned something about getting out and walking, and we can't really get outside and walk anymore. But or we can on nice days, but we still need the exercise. And so keeping that exercise up and finding new ways, whether it's using elastic bands, sitting down and doing chair exercises, or even putting a video on it and doing it together, doing activities together that may keep the exercise going and keep them active. And that also helps with sundowning, because if they're active during the day, they're going to be tired at night. But if you let them sleep during the day, then the sundowning is even more of a possibility.
One of the things you've brought up with exercise before is getting that other person to be more motivated, is to say, boy, I'm really having a hard time with exercising. Will you sit down and do it with me? And then modeling with the person, but having them be part of the team, and so they feel like they're helping you out.
That's right. That's right. And then that helps a great deal. The other thing might be looking at different kinds of activities. They're more indoor. They're not able to be outside gardening or digging in the dirt or picking flowers or walking around. So it might mean doing things like some simple puzzles, some even coloring, but making it sure it's an adult activity and not a child's activity, because people are sensitive to that. You want to make sure it's an adult activity. A couple things that I want to mention is there's a few, you need to look at what that person did during their life. Did they work with tools? Did they like to work with tools? They might have been digging in the garden. I guess you could have a little indoor garden, but they may have liked to knit. So let's say that someone was a knitter. They can no longer knit anymore, but there are some things that they might be able to do. And I'm using this as an example because this is what we got my grandmother to do. My grandmother started covering hangers. And she covered hangers because she wanted something for the church bazaar. And she wanted to be able to contribute something. So she was still able to do this for a while. Eventually, she could no longer do it. It was not working. But this is an example, and I keep it as a memory. But then you may have, she still liked to work with yarn. So you have, you buy skeins of yarn, and they need to be wound into balls. So being able to get a medium that she enjoyed and being able to make balls of yarn for other people to use, or just being able to do that activity, and it may, you don't want it all tangled, so having it in a skein and attaching it to two chairs and letting her wind it around is an activity that is pacifying for her because it's a medium that she has enjoyed. You might want to mention a few things too.
I think about woodworkers, and sometimes it's just finding a plain object and asking them if they could sand it for you and then later paint it. And this is a good time during the holidays that you may find ornaments that are just plain that can be sanded a little bit and they can paint them. Feeding the birds. Okay. Another example in winter that I like is feeding the birds. And here's a simple task they could do is just gather a pine cone from the yard, put some peanut butter on, and then bird seed. And so that can be a simple project for them to do. Another one is I really like having people work as a team in the house. And so you can have the laundry there and just say, you know, I've got a lot of laundry to do. Could you please fold up these towels and then I can do the other laundry? Or can you use and dust around here while I do the floors? Make them feel like they're part of a team and that they're helping you out.
The other thing might be doing activities, since we're in the holiday season, like baking and cooking, and maybe even getting a grandchild or to help make something. Or it may be that they can no longer bake it and measure things out, but it may be that they can pour things in a container and help mix it. Or they can help decorate the cookies, and it doesn't really matter what they look like, just the fact that they are doing it and being involved in that process. All those things are very important, and you have to have somebody with them, but sometimes it's nice to have another member of the family. It doesn't necessarily have to be the primary caregiver, but it has to be someone that you are safe being around in this time of COVID. Not everyone can't be together with everybody.
Music is one thing that is so important in people. It really helps to calm them down. On Facebook, I saw a great article about a ballerina who they played the music of Swan Lake to. And she heard that music and was sitting in her chair and she started to move. In nursing homes, I've seen where there are people who can hardly communicate, and yet the old hymns come on and they start singing and they know all the words. So that is a great way to get people going. Or for a couple, put on that music that you used to dance to and dance around the living room. It's great for intimacy and it's great for the soul.
Well, I have to tell the story about my mother could no longer speak. She wasn't able to use words, and I would bring her to church and she would sing all the hymns. So she was able to, that in her memory, those hymns were part of who she was, even though she could no longer have a conversation anymore. So music has it. The other thing that might be comforting, people might find that even doing home repairs might be something that they might enjoy. Or one of the activities that again is, I think, could be a very important is your church directory. This is our church directory, and someone could open up this act and find somebody that they know and they remember. They may not remember the name, but they would remember the person, and that's why the face recognition is so important. And even people that have passed, so even old directories are great.
Sometimes you just want the individual to have a little one time. And so it's nice to find magazines where they can look and identify with the fall colors, the birds in our area, maybe a hunter thinking back to times when they used to hunt. Magazines like our Wisconsin or Reminisce are really good. The idea of the picture reminds me of a caregiver who did a beautiful book for her mother. And it started from when the person was a baby and all the way up to adult life. And with it, she took original pictures and made copies, but she labeled every single one, you know, kind of the year, this was the schoolhouse, these are the people. And that person enjoyed looking at it over and over. But even more so for caregivers. You know, sometimes the caregivers in our facility, they have no history with that person. And yet they can sit down and they can look at that book and they can say, oh, here's your cousin George. Can you tell me a story about them? And the person who has dementia lights up and starts to give a good story.
There's lots of activities, and you really need to gear them toward what they are able to do. Some of the activities of daily living that may be something that you need to remember is things like even drinking water. They may need a reminder that because dehydration is we don't want dehydration, we want to keep people hydrated, and they may forget, even though the glass is sitting there, they may forget, and you can remind them, have a glass of water, Helen, and they may pick it up. But as the dementia increases, they may not remember to pick it up. And so you may have to hand it to them and they'll drink it. At some point, they may not be able to actually drink it, and you may have to actually help them as they progress in the disease. The other is clothes, getting dressed. These are, again, activities of daily living, of being able to get dressed by yourself. And if you lay out the clothes the night before, or in that morning, then they'll see them and they'll react and be able to get dressed. Not always. At some point, they're not going to be able to do that, and you're going to have to help with more assistance. I want us to, do we want to talk, is there any more activities that we want to mention right now? Because I was going to go into gift ideas.
Oh, that's a good idea.
Okay, here's some gift ideas. Now, you mentioned something about a book that was labeled. These are not labeled, but these are examples of books that you could make. A Shutterfly and Snapfish have great ways of making these books where you have different pictures in the books, and you use your own pictures and you just make yourself a wonderful book. Now there's two kinds. One is you could make one of this year, of recent things and of the family and all the different family members. The other would be to make a book of that person's life. So some things that happened long time ago, pictures of them when they were children, maybe the farm they lived on, a number of different, so you might have several different kinds of books that might be wonderful books for them to peruse on their own or else with somebody else. The other is something like a calendar, a photo calendar, just of the last year or of family, and having different pictures in a calendar that they could put on the wall. One other thing about a calendar that's important is that as they start remembering their daily activities, is actually writing on the calendar. So you have a calendar like this, and you write down the days when they're doing something. So they see that, you know, their daughter's coming this day to visit. We're going to the doctor this day. This day is church is going to be viewed. And being able to write those things on their calendar, and then when they come and ask you, when are we going to do this? You can refer back to the calendar and keep them engaged by using a calendar. So those are some ideas for gifts. But we have other kinds of things, like I would say, as a caregiver, you need to develop a list of all kinds of activities and all kinds of gifts that would be helpful, not only to the person with the dementia, but to you. And we need to list those and have it written out so that you can give copies to family members when they ask, because they're going to ask, well, what can I get him? I don't know. He doesn't need anything. Well, maybe he does need some things. He might need some new clothes that are easy to put on. And if it's a woman, you don't want to have just sweatpants and a sweatshirt. Get something that's got some style to it. Maybe a pantsuit that all goes together. And you could actually get a couple of them exactly alike, and then you can interchange them so that it might make it easier. And it's something that they can easily put on by themselves. The other might be getting clothes that are attractive as well as easy to put on. And sometimes that takes a little doing. You might have to go on the internet and actually find some things because you might not find it locally. The other might be something like respite time. And you can say, I need just a couple hours. Maybe I just need to go to sleep as a caregiver. Or maybe I want to go out shopping by myself or go get my hair done. You know, whatever it might be, those kinds of things are important. But it also, you might ask family, any place from, if someone asks what they can give you. It could be an hour of break of respite, or it could be a whole week of respite. And maybe that would be, they'd go stay, or the family member would come and stay at your house while you really aren't on duty. And that would be a wonderful gift to both family members. Another might be, you mentioned magazines or Reminisce. There's a Reminisce magazine, a farm magazine. You might want to give them some music that you know that they like. Or a bird feeder, not just making a bird feeder as we talked about, or feeding the birds at Christmas time, but maybe a bird feeder that would be in their window and they could then watch the birds as they come during the year.
I think for caregivers too, you know, it's some simple things that would make life nice for you. You know, just saying, I would like someone to make a meal for me. Or, you know, I would like a bottle of wine or a good book or a film to watch, or things that maybe we can't use now comfortably, like a massage or a pedicure, but it gives them something to look forward to in the future.
Right, those are great ideas, Margie. The other thing that is sometimes an issue is the issue of sometimes they become very nervous and anxious at different times. And it may be due to the fact that they're coming down with a cold or have a headache or something like that. Or it may be due to the fact that they're restless. Their activities have changed. They don't have the ability to do some of the things that they'd like to be able to do. And there's something called a activity lap blanket. And they have a bunch of them on the internet, and Becky is going to have, Becky Kinnear will have a list of some of the websites that you can look at, and I'm going to put something on the chat so that you can see an example of one. But if you go online and look at them, there are things that you might be able to make too. So I'm thinking of when our children were real little, they had these activity things where you had zippers and you had Velcro and things that clip together. And those are the kinds of things that may be if they're put on a person's lap while they're sitting down, would keep their hands busy doing things that they know how to do. So those would be something that would be a possibility. Another thing, another gift idea is if you have family member that is a wanderer, then you might want to find, there are some tracking mechanisms that will attach that actually can ring in with your phone. So they will keep track of where somebody is with your phone, so that if somebody tends to wander, you may want to get one of these trackers. And Becky Kinnear will have something for you that you can use.
With the holidays approaching, many of us are used to having large family gatherings. When you have a person who has dementia, that is not a good idea. It's too confusing to them as they're hearing noise coming from all over and they can't sort where it is. So with COVID-19, we know it's going to be different, but in reality, the one-to-one visits are the best because they can concentrate better on what the person is saying and enjoy it more. The other thing is that we don't think about the decorations. A lot of us love Christmas. My house is full of it. But a person in the support group said how she had some sparkly items in her house, and her husband got very agitated with it. He thought it was like aliens coming. So be sure and watch the person and just see what their reaction is to some things. They may be more sensitive to smells. Some people put candles on, maybe smells that irritate them. It might be bright, shiny objects. So look and see what is agitating the person and what they do enjoy. Again, the music is wonderful during the holidays.
Well, this is also an opportunity when you're decorating a tree, for instance, to have them help you decorate the tree, and maybe even make new ornaments if they want to. For instance, making chains, and the chain ornaments of just little pieces of paper where you glue them together and you can make a chain that goes around, or popcorn, string popcorn. Those were activities that we used to do that young people don't do today very much, but that would be the kinds of thing that would be a fun activity. The other is that with each ornament, a lot of times there's a story behind that ornament of where it came from, how that came in your possession, and the person may or may not remember, but you might remember where it came from, and they would enjoy hearing that story again. So it's a chance for stories, it's a chance for activity, just not too much, because too much is going to cause much more confusion and agitation. And of course, we need to be careful of COVID. And, as younger people are coming into our homes, we need to make sure that that person is safe.
With the cold weather, I want to bring up a concern with the wanderers, and Margie addressed the new technology that is out there. Sometimes in the house, we just need to realize that when they get agitated and want to do something or to leave, to redirect them. Maybe just say, okay, we'll go out later, but let's go have a cup of coffee and a cookie right now. Or if they're really agitated, like with the small child, take them for a ride and just get them out for a bit. Other things people have done in the past is on their doors, they have put hooks and eyes up on the older doors in houses so that when they go to open the door, they can't open it, or there are alarms for it, or Margie mentioned having the technology and using that. The other thing to have handy is to have a picture of the individual and also information on the card. So often we read about the tragedies of someone who's gotten out in the cold and has suffered hyperthermia or has been lost. And we need to know that there are resources out there if those situations happen, to not be afraid to call law enforcement. They can get silver alerts out and notify people. I know those are things we don't like to hear, but I think prevention is so important and that we do discuss that.
Well, thank you very much. We're going to have time for you to ask some questions too, so that if you have some ideas or you have some questions that you might like us to answer, we will be able to do that on Zoom in just as soon as this is over. Okay, thank you.
Thank you.
One of the things that I wanted to share with you is some of the resources that will be sent out to you, I think, and there's a dementia activities that are taking place in the next month or so. And I'm going to put it up and share it up on the screen with you right now. Okay, there are a number of activities that are going on. First of all, I want to say there are some research opportunities if there's someone with dementia. And I have here the ADRC Wisconsin, the Alzheimer's Disease Research Center out of Madison does have some studies that are going on. And if people want to be involved in any of those studies, they could contact there at the website or the phone number. The other is that there's virtual cafes that are going on here in the area that are there's one on November 17th where they're going to make an ornament of some kind and do an activity, and on December 8th there is an activity where they're going to take music and do some talk about the history of some of the songs and Christmas music. And then there's another a choral group that it's called the Light Memory Choir is going to be singing and having a concert on November 19th at 6:30. And these are all virtual. There's also a book group, Dementia Reimagined book club, that is available. And for further resources, you can contact Carla, Carla, why don't you wave if you're there? Carla is the dementia specialist for Dunn and Chippewa counties, or you can contact the ADRC, the Alzheimer's Disability Resource Center, and talk to Lonnie Dodge, who is the director there. So there are resources that are available. There's upcoming events that are going to be available, and these will be sent out to you. They are not on the chat. We couldn't figure out how to get it on the chat, so they will be sent to you. Do any of you have any suggestions or ideas that you have found helpful in working with family? Carla, okay, go ahead.
Hi, I'm Marvin. I came in a little late. I apologize for that. I just moved my mother from South Dakota to Menominee about roughly a month ago. Sorry for that.
Somebody's got music on.
Yeah, my phone went off.
Oh, okay.
And couple of weeks ago, actually the area Alzheimer's group called me. My mom has very bad, well, she wandered, got out of the house or out of the building. She lives at our house down the street from Our Savior's. And the people at our house contacted the Alzheimer's group. They have been so helpful with getting her meds regulated, changing her meds. So that would be, at least as far as my experience, that would be great also. Contact them, you know, if you're having a lot of trouble with your parent or loved one being combative or wandering a lot or anything like that.
Do you want to say anything, Carla, on that? Was that, what organization did you contact? The ADRC, the Alzheimer's, the Aging and Disability Center?
I did not. I believe the administration at our house, living center, contacted them, and then they contacted us about helping out.
Okay. Well, one of the concerns that I think, and Paul might want to speak to this too, is medication can modify behavior, and sometimes you need to keep in touch with your physician because they may need to modify the medication. But you also don't want to make somebody into a zombie. You want to make sure that you're not over medicating, and because we can make people so they're non-functional, and people can function with dementia, even though, but you need to modify and make sure that it's appropriate medication, and not so that they can function as best as they can. I don't know.
I agree with that. So far, they have been very aware that they don't want to make her a zombie, like you mentioned. They just want to make her more relaxed and help her to accept her new surroundings, because they are all brand new, moving 300 miles.
Right. I remember my mother tried taking the hinges off the door in the unit that she was in for the first week until she adjusted. Anyone else have any comments on it? They'd like to...
I just wanted to add to that. As a primary care physician, I just want people to know that we work closely with our pharmacists and can do specific medication consultations, have the pharmacist do a specific medication review with patients to ensure that the medications that they're on interact well with each other and don't cause negative side effects for patients.
Okay, Becky?
Hi, I have an idea or a suggestion for the holidays for maybe a family giving to a person with dementia. My mother-in-law has dementia, and we have been able to use this device called a ViewClix. I don't know if anybody's heard about it. I put it in the chat, the name and how you would find out about it. But basically, it's like the size of a iPad, and the person has it in their home. They have it set up. They often, when people try to communicate with a phone, the person doesn't know how to do it, or they don't know what button to push or whatever. So this is just something that's sitting there, and family members can just click at home and their face appears on that screen and they start speaking with them. Again, the person doesn't have to do anything. They would have to be able to hear, but it has been a wonderful device. In fact, my mother-in-law for a while was at Neighbors this summer after she broke her hip, and then we could have it. They help us set it up in the room so we could keep in contact with her. So it's really a nice, a nice thing. It costs about $200, but might be a nice thing for kids, and because a lot of people can be on it. And the other feature of it is that you can upload pictures. You could upload pictures from, any time from when they were young or older, memories, and those continuously scroll through. So you can have them scroll and that person can look at it. So someone working with them could, point out, ask them, or just refer to that. So it's a way to keep connected.
It's a great resource. Carla.
Becky, I would just like to echo that. I've heard from several caregivers how useful that is and easy to use for folks. I just found out about something on Friday. Alexa, there's a new feature on it now. It's called Care Hub, where you can talk to the little Alexa Echo and speak directly to that person, and they can speak directly back to you, that there's not, they don't even need to push a button. It's just an automatic. The other feature that I've heard really good results with is the Echo Show, which is a lot like the View Clicks, where there's a video screen and you can call that person directly on that screen and it'll come up. They don't have to push the screen, anything. It's just an automatic talking back and forth. So that's been really handy for people too.
Mhm. Okay, those are great resources. Anyone
Maybe
else
Carla, if you could put those in, I was going to say, if you could put those in the chat thing too, and how you, if there is a website or something.
Sure, absolutely.
And if I can jump in just for a second, one other housekeeping business. If people could drop their email addresses in the chat, I'll try to get an email out to everybody with some of these resources and the document that Margie shared earlier. So you've got that to refer to.
Okay. Any, yes.
The other thing I'd like to mention is the importance of caregiver support groups. Being a former support group leader, I saw how valuable it was for family members to sit down with other people who understand what's going on. In these hard times, sometimes we have to Zoom, and Carla has resources on that. But so often as a family member, you are talking about the disease, but you may have a brother who is 2 states away, and they'll say, well, you know, it was fine when I talked to mom or when I came to visit. It's nice to talk to people who understand what you're going through and who also might have good ideas for you to use.
Sally, I think I saw you raise your hand too, if you had a question or comment.
Unmute, Sally. Unmute.
Now, is that okay?
Yeah.
Okay. I don't have any direct connection, but I know Margie and I like to hear her presentations. And also I've seen a presentation by Becky Kinnear. And at that time, she mentioned that there are several stages of dementia. And my question is, do some people never get dementia, or are we all in some stage of dementia?
Some people do not get dementia.
Okay.
And
That's good.
So, and there are some losses that we get as we age that are not as good as it used to be, but it doesn't mean that it's a dementia.
Okay, that's good to know.
Any of the physicians want to speak to that issue?
I just want to agree.
So, although we all have problems as we age. Carla, unmute. Yeah.
So I just want to touch base with what Margie said about the caregiver support that is so important, especially with people being more isolated right now. And we do have a lot of resources and seminars coming up. I know that some people are limited with Wi-Fi and connectivity issues. And I just want you to know that as part of the ADRC, I have been doing a lot more just one-to-one phone conversations with people and helping them work through any situations that they have. The nice thing with Zoom, if that's an option, is we've been doing a lot more family counseling, and it doesn't matter what state the children live in. This is a family conference that we can have and get some solutions around that. So that's one benefit that has come from that, is we're doing a lot more family support and education through that.
Becky?
And I would echo what Carla just said. when my mother-in-law was initially diagnosed many years ago. She's 99 now, but when she was initially diagnosed, the kids lived in different areas. Someone was in Illinois, and they were all over the place. So Lisa, the dementia specialist in Eau Claire, did those phone, set up those phone conferences, and it was amazing because I think we had like 4 of them. And in between, we each had kind of assignments to do, and it made all the difference because everybody then was on the same page. And so I would echo that. That's a wonderful opportunity.
Lee, did you have something you wanted to ask? Yes. Did you have your hand up? No, okay.
Well, this seems like it may be an opportune place to pause. Maybe let me just throw out one last time if anybody has any questions. Otherwise, Margie Hagman, any last comments you wanted to make before we close for the morning?
No, I think that there's a lot of resources that are available, and we just need to tap into them. And we also have people that are not ready to talk about it and be part of a group yet. And we need to encourage people within our own congregations and in our own churches, because the churches are someplace where people do feel safe. And we need to reach out to people within our own congregations and try to get them the support they need. And for a while, it might mean just one-on-one having a chance to talk with somebody else. And we need to do that. Margi Stauss, do you want to say anything more on that?
No, I just think November is Alzheimer's Month, and I guess we are encouraging in our church, and I'd like to encourage you, is to reach out to those members in your church, in your community that you know, because they all need the support, both the individual and the caregiver.
Well, wonderful. Jan, go ahead. Jan, you're muted.
I would just like to thank the 2 Margies for their presentation today. And I just wanted to add one thing that both of them have been very involved in, and that's making Dunn County a dementia-friendly community, which means that they have been going out and speaking and doing training in grocery stores, pharmacies, churches, banks. We have quite a long list that they have gone out to speak, and that's wonderful, so that the understanding about dementia with staff and workers is something that to help people feel comfortable when they go into a bank and they're fumbling or having trouble, that those staff members understand what's happening. So
Absolutely. Thank you. Thank you both, Margie Hagman and Margie Stauss. Thanks, Jan, for coordinating this and introducing. Just two more points of business before we close. We are taking a brief pause for the holidays. In January, Ruth Husky will join us to talk about the resources at the ADRC. Thank you, Becky Kinnear, for communicating and coordinating that. And then lastly, everybody enjoy your holidays, be safe, wear your masks, wash your hands, stay safe. Thanks to everyone, and enjoy the rest of your day.
Okay, thank you.
Thank you.
Thank you.